I was going to just ask you, and I will, about why people were so frightened. And also, I was going to ask you about the difference between Brazil and Peru and how Peru fared in terms of deaths, because I was just going to say all this hard lockdown didn't really have the effect of giving you a much better outcome in terms of excess COVID deaths. You were not really much different, I think. Is that right? I mean,
Yeah, well, the death toll in Peru was really high, and I think Peru provides an interesting case study to assess the effectiveness of lockdowns as a policy response to pandemics. Um, Not only giving, the death tolls, it was very hard for Peruvian families, but also considering the wider implications in terms of economic and social impacts.
yeah, so just to be very specific, Brazil was kind of very, very criticized in this country for not locking down very hard. It's kind of comparable in terms of temperature, in terms of sort of socioeconomic factors, I think, and populations. But Brazil had less, I think, or comparable excess deaths or COVID deaths to Peru, which went really hard on a lockdown. So what we can see from that real world study is that the hard lockdown in Peru did not have the impact that was wanted. It did not stop the virus, it did not stop it spreading, and it did not stop deaths. Is that right?
Well, from my perspective, I mean, looking back, I think that the lockdowns create more problems than solutions. Of course, there's a key variable here, which is the capacity of our health system, which by the very early days of the pandemic could not have, the capacity to respond to the situation. So, I understand that, at during the first months, given the situation and the capacity of the health system, you had to take these hard measures because you had to assess the situation. But, after, I would say the first wave, what we needed to do was to assess in terms of what other countries were doing. But I think Peru was heavily influenced by the way the US was coping with this, pandemic. So I think back then, it's easy to speak now that we're not in the emergency situation. There was a lot of fear, but I think it would have been better to have a wider perspective on how different regions of the world were responding to this emergency. So governments could also see, which other options were available.
Understood. Yeah. And why were people so frightened in that first wave? Do you think it was a fear that was justified? Because we knew actually quite early on, although it wasn't necessarily broadcast or publicized very much, but we knew fairly early on from the Diamond Princess and from other studies, in fact, a study that Professor Bhattacharya did, that this was a virus that affected older people. And in fact, the average age of death for a COVID patient was also the average age of death. So why were people, given that knowledge, even if they didn't know it early on, why were they so scared? And why did they obey, do you think?
Well, when the emergency hit, people were basically left by themselves to solve,
But were
the
they
situation.
were they given public broadcasts? Were there scary adverts? Why were people so terrified? Because it was only someone who decided that this was a huge threat to such a big population, but it ended up not being. It wasn't a threat to children. It wasn't a threat to people younger. So why were people so scared?
Well, because when it was communicated as a general threat. I mean, of course, you had vulnerable populations, but something that, got really hit into public discourse was that, okay, when you got infected, what would you do? And something that was common back in 2020, 2021 was to, get oxygen. And it was really difficult to obtain oxygen in big cities. Also, in other areas of the country, it
How
was
was that
very expensive.
communicated? Did you have big billboards? Did you have TV adverts? How did people come to think that they would need oxygen? What was the communication? How was it delivered? On television?
Well, you had a lot of, like reports on the media, and also family stories. And I mean, well, in the second wave, for example, my family was hit. 4 family members died in a month. I mean, for, different complications, some of them in the private health system, others in the public system. But again, back then, the problem was if they got access, the right access to oxygen, the right access to support. So something that was really frightening for people was the inability to secure medical support on time, and at some point, hospitals were, overcrowded. So people had to, take, and go through through COVID at home. And that's why, things got complicated, because when you had, for example, complications, people had to hire, oxygen providers, and it was absolutely pricey. It was really expensive. So it was, the situation, I mean, was scary, not only in terms of, an unknown sickness, not only in terms of the difficulties to obtain medical assistance, but also the major economic impact for households. Going through COVID was a situation that could, compromise family finances really heavily.
Yes, understood. So in that sense, we talked about the first wave and assessing the situation and working it out. And then you said by the second wave, it started to cause the lockdown started to cause more problems than it solved. Are you able just to explain that a little bit more? Why did it, given that it was a threat, given that it was killing people, why do you think it actually caused more problems than it solved?
Well, I think, given the reality, of the structure of Peruvian economy, I think households had a very difficult time, in particularly households that could not have a permanent source of income. For these people, those years, they were basically left by themselves. And yes, the Peruvian government did provide some assistance, did provide some programs, and all of that happened. But as you may imagine, it was not permanent. It was not enough for the ones that were bearing, the heaviest burden. So I think we took a long time to make policy adapt to what was actually happening. Because as you may imagine, in many areas, I mean, lockdown was mandated, but people had to go out anyway. People risk it because they had to survive. And after that, in terms of, enterprises, the commercial sector, it was, I mean, this whole, health measures that were imposed, as for example, have like specific adaptations and ventilation and the alcohol and the specific, masks that you had to wear. I think there was a lot of, expenses that were put on businesses to reopen that when you look back, I mean, most of them were not necessary, but it was an extra burden put on people that wanted to, go back to business and continue with life,